we've talked about a lot that American healthcare is not so much healthcare, but rather a sick care. So rather than keeping people well, it's completely oriented and aligned around treating people when they're sick. I would love to know, how do you feel about the current state of healthcare, and what do you think we need to do to make it more patient-centric in terms of cost or accessibility or wellness?
I think we need something new. Working with a lot of these big providers, they're not looking for something that's going to move a small needle. They want to move a big needle. And there's lots of cool ideas. I'm sure many of the people that you guys are working with who have not billion-dollar ideas. They're not going to save an organization billions of dollars, but they could help 10,000, 100,000 people do something very good for themselves. But again, like I mentioned before, that requires new business models. Imagine if you had $200 a month from your health insurance that you could do whatever you wanted with. Like, that would be a really unique way. And it was free to you. Like, you're already paying for this service. I know these are happening in some employer healthcare systems, but that would be neat. But I don't think that people sell these things enough, right? Like, they just don't know how to communicate to consumers in a way that's very important. So, like, you look at Noom, like we talked about earlier. Like, Tony Robbins can sell something because you believe he's going to change your life.
Right.
Like, Noom, you believe it's going to change your life. This digital wearable thing that actually can change your life, you don't believe it'll change your life. And that's a big problem.
Right. Yeah, no, that's super interesting. And I think that's where these direct-to-consumer models are interesting to follow, because it really is flipping who determines what is valuable in terms of care. And I think the examples that you've mentioned, and then all these emerging direct-to-consumer models, whether it's primary care or LASIK, and of course ED was like the big home run early on. It's just going to be super fascinating, because that is the market determines what is valuable for me in terms of my care.
Well, and the awareness of it too as a consumer, right? Like, there's a billboard on ED on my going to my house every single day, so if you have that problem, the odds of you making that phone call go up exponentially.
Absolutely. Yeah, no, I get 10 emails and 3 spam calls. It seems like every week I'm at
Totally.
So not even just billboards. It's a random person.
It's like, you might get diarrhea or death,
Oh gosh. Oh well, yeah. Those people don't include the disclaimers. They don't have that button, man. This is a big idea.
Not yet.
Right.
Not yet.